Attention deficit hyperactivity disorder (ADHD), similar to hyperkinetic disorder in the ICD-10, is a neurodevelopmental psychiatric disorder in which there are significant problems with executive functions, attentional control and inhibitory control that cause attention deficits, hyperactivity, or impulsiveness which is not appropriate for a person's age. These symptoms must begin by age 6 to 12 and persist for more than 6 months for a diagnosis to be made. In school-age individuals, inattention symptoms often result in poor school performance. Although it causes impairment, particularly in modern society, many children have a good attention span for tasks they find interesting. Despite being the most commonly studied and diagnosed psychiatric disorder in children and adolescents, the cause in the majority of cases is unknown. The World Health Organization estimates that it affected about 39 million people as of 2013. It affects about 6–7% of children when diagnosed via the DSM-IV criteria and 1–2% when diagnosed via the ICD-10 criteria. Rates are similar between countries and depend mostly on how it is diagnosed. ADHD is diagnosed approximately 3 times more in boys than in girls. About 30–50% of people diagnosed in childhood continue to have symptoms into adulthood, and between 2–5% of adults have the condition. The condition can be difficult to tell apart from other disorders as well as that of high normal activity. ADHD management recommendations vary by country and usually involve some combination of counseling, lifestyle changes, and medications. The British guideline only recommends medications as a first-line treatment in children who have severe symptoms and for them to be considered in those with moderate symptoms who either refuse or fail to improve with counseling. Canadian and American guidelines recommend that medications and behavioral therapy be used together as a first-line therapy, except in preschool-age children. Stimulant therapy is not recommended as a first-line therapy in preschool-age children in either guideline.